is the first test, that is Fader. So for this test, you're going to flex the patient's hip and you're going to adduct their knee and internally rotate. A positive for this test is reproductions of signs and symptoms, and the pathology is a labral pathology or impingement. Okay, so this next test is the hip scouring test. So you're going to passively flex your patient's hip. You are going to axial load, and then you are going to rotate them into internal and external rotation. Are you okay?
Yeah.
Okay, good. A positive indicator for that is pain and apprehension, and pathology is labral pathology, impingement, or osteoarthritis. Okay, so this next test is the Trendelenburg test. So what you're gonna do is you're gonna have the patient lift up one foot, and you are gonna watch their PSIS. So you're watching for the non-weight bearing PSIS to drop. That would be a positive test. And then the pathology is weak gluteus medius. The next test is the femoral nerve traction test. So what you're gonna do is you're gonna have your patient bend their bottom knee. You're gonna stabilize their hip. You're going to abduct their hip and then extend to 15 degrees, and then you're gonna slowly flex their knee. A positive test would be reproductions of signs and symptoms, and the pathology is femoral nerve pathology. This next test is the straight leg raise test. So what you're gonna do is you're gonna stabilize above the knee, you're gonna grab your patient's ankle, and you are just going to lift up, keeping the leg straight. A positive test is reproductions of signs and symptoms, and the pathology is neuropathology. This next test is called the slump test. So you are going to have your patient sit nice and tall and have them interlock their hands behind their back, slay, and then they're gonna look forward, eyes up. Sorry. And then you are going to have them slump over, slouch, good, and then you're gonna put your arm here, you have an off of head, and then look down. Okay. Put pressure on their head, and then dorsiflex your foot and raise your leg. Awesome. So positive test indicates it's reproduction of signs and symptoms, and the pathology is neuropathology. So this next test is the Koenig-Brzezinski test. So you're gonna have the patient flex their head, and then you are going to unilaterally raise your leg straight until point of pain.
Okay.
And then you are going to flex the knee. Pain?
No.
Okay. So positive test is reproductions of signs and symptoms, and the pathology is neuropathology. So the next test is the SI compression. So for this one, you can put your hands on the outside of their ASIS and press inward, medially, or you're gonna, and then for the SI distraction test, you're gonna put your hands on the inside of their ASIS and press laterally. And positive for both of those are pain, and pathology for both of those are SI sprain or dysfunction. So this next series of tests are the SI dysfunction screening. So what you're going to do very first is you are going to look for their iliac crusts, and let me find it. And then you're going to see how level they are. See if one is higher than the other. Okay, and then one being higher is a positive test. Next, you're going to find the PSIS. Sorry, I'm trying not to like tickle you. I'm not there. Okay. And then if one is more superficial or depressed than the other, then that would also be an indication of SI dysfunction. With your fingers, your thumbs still on the PSIS, you're going to have your patient bend down at the trunk. You're going to watch your thumbs rotate. Rotating up would be another positive for SI dysfunction. Okay. And then both of them should rotate up for that one. Next is you're going to have the patient bring the right knee off the table, and you're going to watch and see if your thumbs rotate. They do not, and then you'll do the left knee, and they should not. So rotating up is SI dysfunction, and then for the bending of the trunk, rotating, they should both rotate up. And then next, you're going to have your patient stand, facing the side. Perfect, you're going to find their PSIS. Maybe on your shorts yet. And then you find their ASIS, their thumb, and they should be pretty level. And they'll do that on both sides. And then the last one is you'll have your patient lay down, supine. Perfect. And then you're gonna look at their medial malleoli, and then you want to see if they line up. And hers too. Your teeth. Next test is the Hoover test. So you're gonna grab your patient's legs, hold them up. You're gonna ask them to lift the leg of the one that hurts, so lift your leg. And then you'll feel pressure. You should feel pressure in the other leg. So positive test would be lack of pressure, and then the pathology is malingering. Okay, so the next test is a lateral rib compression test. So you are going to put your hands on the ribs and compress laterally, and then is the anterior posterior rib compression test. So you're going to put your hands on the anterior and the posterior and compress, and then do it on the other side. Press. A positive test would be pain, and then it could indicate a fracture. Okay, so this next test is the brachial plexus compression test. So you are going to put your hands on their head, laterally flex, and then you're going to axial load. So positive of this test is reproduction of signs and symptoms, and then the pathology is brachial plexus traction injury. Okay, this next test is the Adson's test. So you're going to palpate the radial pulse, and then you're going to straighten and abduct the arm into slight extension, and then you're going to have the patient look at the hand. Perfect. So positive of this test is diminished pulse or numbness, and then the pathology is compression of the brachial plexus.